Now, have we finally found the silver lining to the COVID cloud? It seems it's led to a surge in investment in laboratory medicine in Africa. It was historically undervalued, overlooked and underfunded. Well, the role of medical labs is being discussed at the 2022 Africa Health Conference. So let's discuss this now with Lebogang Motswaledi. Lebogang, thank you for your time and good morning to you. Do you think that's the case? I mean, with the COVID-19 pandemic, more focus, investments have been put into laboratory medicine?
Yeah, definitely. It's definitely the case. So when COVID hit our shores, a huge spotlight was put on it, and obviously, naturally, so more investors and resources would need to be diverted that way, and hence we saw more investments being put in that space, and it's actually the fastest growing industry both globally and locally.
What do you think, perhaps historically, we've seen, the laboratory medicine in its entirety being overlooked, being undervalued, and often, just not enough emphasis is placed on it being properly understood. Why do you think historically that was the case?
So that was the case because, like you were saying, we were just, I think because a pandemic hadn't hit us, or well, a pandemic as on the magnitude of COVID hadn't hit our shores as yet. So it was very easy for us to poorly understand that sector. But it really helped a lot in installing the testing, well, not stalling, but what I'm saying is it emphasized and it put a highlight on our testing abilities, and we were actually prepared for them because our labs were not really underutilized, but then they were actually put to good use, and we helped other nations. We started testing way before the virus hit our shores. So in essence, we weren't appreciating it much until COVID happened.
Yeah, and I know when we look at the growth, I mean, I'm seeing here SADC's clinical laboratory industry estimated to be, the fastest growing in the region, and now even attracting, more in its sphere. What does this growth then mean? I mean, when we look at potential opportunities, when we look at market expansion, surely there should be more to look forward to with this estimated growth that continues to grow within the SADC region.
Yes, definitely. So like you mentioned, it is estimated to be the fastest growing, and both globally and internationally. It has created an abundant opportunities for investment and market expansion. And it's become a very lucrative sphere for investors because initially it was undervalued and poorly understood.
With those who are actually working behind the scenes in healthcare, I mean, the like of Professor Abdul Karim, we've seen them being honored, for the extensive work that they have done in South Africa, and I suppose even globally. And I'm just mentioning him, but there's so many others. What does it mean about the profile of healthcare workers in the SADC region, in Africa as a whole, and, the talent that we've seen, the work behind the research that we have seen? What does that mean then for the profile of the healthcare workers in the continent?
So firstly, we just have to give kudos to the clinical laboratory professionals. They were the unsung heroes, really. They demonstrated dedication to their field, making sure that monitoring, tracking and testing is happening throughout. So we definitely basically need to equip them as much as we can in their line of work and field. So for them, it just means more responsibility, more growth, and just a greater them having a greater impact in the whole lab industry at large.
Yeah. I want to talk about the testing capacity within the continent, Lebogang, if I may. I mean, I think it's widely recognized that even during the global pandemic, Africa wasn't only dealing with COVID-19, right? There were other epidemics that the continent was dealing with, the likes of Ebola, the likes of measles, cholera, just to name a few. If this is where we are as a continent, where we are showing international standards, almost balancing multiple epidemics at the same time, what does it say about Africa's testing capacity, do you think?
I would say it's really, like you're saying, on a world scale level. We have the infrastructure. We've proved it vital. Well, we've proved ourselves to be capable of conducting these tests. And like I mentioned, we were starting to conduct these tests even before the virus hit our shores, and we were really prepared for this. As compared to it, we could have had a worse impact compared to nations like Asia and the EU. But because we are capable and we have the infrastructure and the resources, we managed to manage this whole pandemic in an orderly manner.
Yeah, and I spoke earlier on about, the Africa Health Conference, which is taking place. I suppose this amongst other conversations that will be taking place there. So take us through what we can expect from the conference.
Yeah, so the conference will be happening at Gallagher Convention Center from the 26th to the 28th of October. It will be co-located alongside MedLab Africa, and we have 12 CPD accredited conferences, which people are more than welcome to visit our website to have a look at the program. But we have great speakers locally and internationally, and we'll be looking at topics such as collecting data during a pandemic. We'll be looking at topics like turning point in shaping the future of medical laboratories and so on and so forth. Like I said, your viewers can visit our website and view the agenda properly.